morning to all the dignitaries who are assembled here. Special thanks to Ajit for including such a topic, which usually brings in sad stories in the opening, as an opening speech itself. But let's look at the positive strokes that are important for us to realize how important today the issue of malignancy as a whole and breast cancer so specific. Now, if you look in the scenario of economics, 3-4 days ago, Times of India carried an article which tells 5.6 billion rupees are lost to the country with just one cancer, that is head and neck cancer. Then you can imagine breast cancer being the commonest cancer among the women, and it is one of the commonest killers in the world today. How important it is to us, all the women. Mind you, men also can get breast cancer. So, what is so relevant for us? India is an emerging power economically, but if one cancer can produce a loss of 5.6 billion, how much money will be lost when all the cancers are put together? And every cancer in the world are increasing. Kerala being number 2 in the total incidence of cancer in India, thanks to the development, thanks to the economical development. We assume Western lifestyle and changing from the traditional way of life, and more women are coming into white-collar jobs. In fact, women are the fulcrum of the family. They spend extra 8 hours for the family, but not paid. And so the whole scenario of white-collar job, change in dietary habits, and as you know, hormone estrogen is the #1 causative factor for breast cancer. Obviously, all women have got estrogen. So there are issues which we address as positive strokes in how to manage this deadly cancer. Mind you, apart from genital cancers like uterine cancer, cervix cancer, ovarian cancer, which are all on the rise, and alarming increase. Apart from all these things, today, women are coming with lung cancer, non-smokers, and so common today, so is gastric cancer, colon cancer, and even tongue cancer. So therefore, there is a total scenario, change in scenario of the cancer incidence in the country or in the world. So what is so important about breast cancer? That is my topic, so I am not going to harp on other subjects. Way back in 1996, I came back from my training from Tata Memorial Cancer Hospital, Bombay. For about 10 years I was there, and I joined Kolanjeri Medical Mission Hospital or Medical College. And then I moved on to Lakeshore Hospital as the head of the Department of Cancer Division. After 11 years, I joined Renai Medicity as the head of the department. And currently, after 10 years, I moved to Manjummel Hospital. You must be knowing Manjummel, boys. The place, exactly same place. There's a hospital which is more than a century old, established in 1888. We are going ahead with a supra-major hospital, about 1,000 bedded, with all super specialities, and going to cater to the common man of the state and India as a whole. So now, why is it so important about breast cancer? As you know, breasts are the symbol of femininity, and you can imagine the psychological trauma that a woman is going to face when the sad story is going to come out that you may have to lose your breast for treating breast cancer. So this is an important message for all of us. When beauty is linked to a cancer, the loss is like an organ. So therefore, we must understand that when the world changed and more incidents in cancer came, so also developments occurred in the field of basic science in oncology, and so many newer developments appeared in the world. So those tumors which were thought to be incurable are currently taken into as curable cancers because of the changes and understanding and gene analysis and so on and so forth. So that makes the world a different world for us to live in. So what is the most important message that we should take forward? That breast cancer is also a preventable disease. That every woman should realize. They change their lifestyle. If they are able to change their dietary habits, if they are able to reduce the fat in the body, if they are able to readjust their dietary habits, and as I said in the beginning, woman is the fulcrum of the family. Therefore, the entire health of the family, as per Kerala standard or an Indian standard, remains in the hands of the woman who makes the decisions in the kitchen. So cancer prevention starts in the kitchen. And there we have to understand what dietary interventions we should do and how to detect cancer early. And breast cancer is one cancer which can be picked up by the patient even before it becomes a big issue to the woman. That's called self-examination. In those who are menstruating or premenopausal women, breast examination is done in the mid-cycle and not immediately pre or post menstruation. Those who attain menopause, any day is a convenient day in a month. So self-examination as per world standards and world data can detect more than 60 to 70% of the malignancy in the early stage, which means curable. So how to bring more women into curative level? And that is the most important thing. Similarly, there's a screening program called mammography, and that can detect the disease more than 90% of the situation, 90 to 95%. So it is mandatory for women above the age of 30 to undergo examinations. If required, mammography, but usually mammography is advised above the age of 40 to 45. When the estrogen level goes down, the breast assumes a different shape, and then mammography becomes more accurate. Before that, we have got latest developments in ultrasound scans, known as 3D ultrasound, and so many advancements in the world. So this is one cancer preventable and treatable. What is the treatment part? Gone are the days of mastectomy or chopping woman's breast out. Today is the era of breast reconstructions, breast oncoplastic surgery, which means you give back the disease, the breast, what is God has given, in the same way, in size, shape, texture, in sensations, the same way that God has given through modern techniques. And that is what we are practicing in Manjummel Hospital. And that is a revolutionary change. We can do all these things, provided there is an element of caution, there is an element of watchfulness, there is an element of self-discipline, where it is mandatory for every woman, at least minimum, to undergo a self-examination. Mind you, in the olden times, when we talk about cancer, that's a disease of old age, whereas now it's a disease of young age. That's the problem. Many women may not have attained their professional level of excellence. They may be on the ladder of climbing up. At that time, we fall prey to a disease like malignancy of cancer. The whole family is shattered, the woman is shattered, and society becomes burdened. So therefore, it is possible, provided there is a mind. Therefore, the mind behind the person decides the success story in malignancy. Early detection saves lives, quality of life, cost of treatment. You know that if the disease is advanced, more aggressive treatments, more cost, and more physically damaging treatments. Whereas early detection, organ preservation, preservation of beauty, quality of life, and you become rehabilitated as a fit person to the society to continue with a cure. So therefore, in this first speech and note, I will urge all of you, even those who are having big business firms, to ensure that your women employees are advised to undergo regular screening program. And today, more than 80% of the women in Kerala are employed either in IT world or in other areas, wherever, which means your employer has got as a duty. That's why Ajit has brought in this big meeting. Most of you who are honored are having some firm or other under your custody. So all your women employees need to be empowered. And that is through giving the awareness and education so that we'll have a bright future, a bright Kerala, and more enterprising results for the future. Thank you very much for your patient hearing, and good luck for this conference.